Last winter was brutal for clinicians working in respiratory healthcare, and this winter could bring more of the same challenges. Well, we're here today with Dr. Paul Walker, who is chair of the British Thoracic Society, to discuss the measures that are being taken and those that still need to be taken to address the ongoing crisis in respiratory care. Dr. Walker, health inequalities remain a real challenge right across all fields of medicine. How, though, do they impact respiratory healthcare specifically?
Health inequality is hugely important to respiratory medicine. Fundamentally, we're never going to be able to deliver what we know we can unless we tackle it. Probably the best example I can give for information specific to respiratory is a recent publication by the Office for National Statistics. What they did is they took the most deprived communities in England and they took the least deprived communities in England. And then they looked for a whole series of health conditions, how likely you were to die of those conditions. And the biggest gap, the biggest health inequality gap is in respiratory conditions, three conditions: COPD, lung cancer, and asthma. Fundamentally, if we're going to level up, leveling up has to mean addressing this gap. The good bit is that we already have work and insight into how to improve access, how to improve engagement with healthcare, how to improve primary prevention. But the key thing for us is that this has to be a frontline priority, not one of 20 or 30 different priorities. This is absolutely fundamental if we're ever going to achieve what we want to for respiratory patients.
So what additional challenges have the last few years brought to the diagnostic process of lung healthcare?
That's a great question. They've had an absolutely enormous impact. I mean, COVID, at a fundamental level, is a lung disease and gives you pneumonia. And at the most basic level, lung function testing involves emptying the whole contents of your lungs into the surrounding atmosphere. That basically stopped respiratory diagnostic testing taking place really for 2, and in some cases more, years. The problems from that are, firstly, the obvious. There's an enormous backlog. There is lots of work we have to catch up on. But the bit that's probably less well understood is that before COVID, large areas of the country either didn't have any service at all for respiratory diagnostics or had a really inadequate service. And if you combine those two things together, we're just really struggling to restart services and get services up and running because at the moment it's difficult to access funding. A positive thing, the community diagnostic centres, they're often talked about and they are coming online and they are providing a contribution, but they're never going to be the whole answer. And I think the BTS would say that there was a recent article in the British Medical Journal that described this current situation as a silent scandal. And we certainly agree with that, and it needs tackling now.
But there is some good news in respiratory healthcare, isn't there?
So there are a couple of absolute game changers, but I can't answer a question about sort of developments in respiratory without complimenting my respiratory research colleagues in the UK. They're genuinely world leading, and anything I'm about to mention, they've contributed to. The two big areas, firstly, cystic fibrosis. There's a new group of medicines they're called the CFTR modulators. And effectively what they do is they try and correct a CF gene that isn't working properly. Using these individually and now in combination, this has absolutely transformed people's lives. People are throwing away medication that they've used for years. Their quality of life is completely improved and they are living for years and years longer. A total game changer. The other key game changer in respiratory is in severe asthma. Again, it's another group of therapies, medications called monoclonal antibodies, which target specific types of inflammation caused by asthma within the lungs. And they've had similar improvements or cause similar improvements for people with severe asthma. Those are two really from the last 10 to 15 years or so. And I promise you there are others coming. So there is a lot to celebrate.
So, Dr. Walker, what do you think are the most important things that a UK citizen, the general public, can do to help protect our lung health?
So the first answer dwarfs all the others put together, which is stop smoking if you smoke, or don't start smoking in the first place. It's so important for respiratory health. But beyond that, exercise is really important. We actually use exercise as a treatment and therapy for many lung conditions. And not only does it make you feel better, fundamentally, if you're fitter, you can do more with the heart and lungs that you've got. Beyond that, I'd love to say avoid pollution. That isn't really possible. But if we all use fewer fossil fuels, then we're all going to be inhaling less pollution in the atmosphere. A good diet helps the immune system. And I don't think I can avoid mentioning vaccination. An awful lot has been said about vaccination over the last few years. We've been vaccinating people for well over 200 years, and every single year, millions of people's lives around the world are saved by vaccination. The key for me is that a lot of the vaccinations that people are going to be offered are to prevent lung infections. So the other thing I would say is if you're offered a vaccination, then take it. And if you just do some of those, better still, all of those, then you will improve your lung health.
Dr. Paul Walker, thank you very much indeed.
Thank you very much.